Hello and warm welcome to everyone joining us today. I'm your host Dalvinder Kaur from lovely Professional University. We are excited to have you with us and look forward to an engaging and insightful session. So sit back, relax, and let's dive into today's topic, that is Hypoxic training for rehabilitation, a new frontier in physical therapy. Before we proceed further, allow me to introduce the expert of the day, Dr. Thai Garajan Subramaniam, Professor, School of Allied Medical Sciences, Physiotherapy, Lovely Professional University, with 24 years of expertise in post cardiac surgery recovery and evidence based therapies. With a passion for improving patient outcomes and a focus on clinical excellence, Dr. Subramaniam continues to be a driving force in the field of cardiopulmonary care and more. Before we proceed further in today's session, I would like to request everyone for any questions. You can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. Now I'm going to hand over this session to our expert, Dr. Thigarajan Subramaniam, and it would be an absolute delight to listen from him. Over to you, Dr. Thigarajan.
Thank you, Ms. Kaur, ma'am. Yeah, so this is my second opportunity to take the webinar on board. Start with little delay due to the technical glitches. Hope I'm audible to all of you. Okay, yes. So we have a different field in healthcare practice. As you know very well, medical practice with MBBS, dental, and as well as veterinary sciences, and so on. So my expertise in the area of physiotherapy, which is actually dealt with the physical modalities like hot and cold, electrical modalities, physical exercises, and so on. So my ultimate aim is how some advanced techniques can help us, our athletes, to reach their heights in their career. Okay, in all types of the training. Okay, so do you know what kind of these sports which require physiotherapy? Can you just put message in the chat box or any other comment box? Yeah, of course. So very common game which we are seeing in our television or nowadays very famous in every 4 year events of Olympic events, okay, Asian Games, so and so on. We have a multiple games, multiple sporting events which require a basic terminology or basic form. Can you tell what it is? Anyone? You can write down in the comment box. Yes, correct. You are right. It is nothing but fitness. Fitness is the a key for the all of the success of every sporting event. Just imagine the fitness is nothing but when you are able to do the work with the efficient time and the efficient task. The time taken for doing that work and the type of the work. Okay. So which I just want to enhance the fitness level by doing different activities, practicing at the gym, practicing at the ground, then we'll go for the real contest. This all every one of us know. Okay, if someone got injury, someone got some kind of the pain in their joints, they could not able to run, they could not able to take part in the event or the contest. So in this scenario, how we are going to train those athletic populations? It's again really a challenging one. And if they are not able to go into the practice, okay, so this particular situation, am I audible, ma'am?
Yes, sir, you are audible. You can continue.
Yes, yes, okay, okay. Yeah. So the point is different types of the games which may leads to various issues or injuries that may minimize the real efficiency of that particular the sports person. Okay, so our main aim is how to restore their function or how to train them in a short interval with various methods. Okay, so though you are from the different domain, those who are from the different area of the interest, the people watching this particular video, maybe this session which may help you to identify the gaps in training those particular situations. Okay, so here the major point of the training which we are going to focus is the hypoxic training. Okay, I'm not much delay, without much delay I just open what is hypoxic training. Anyone? Yeah, if you know that, you can just give in 2 3 words what is meant by hypoxic training. Of course, if you are not a sports person, you may not hear about this word, the terminology. The hypoxic training is nothing but it is the training without the oxygen or reducing the amount of the oxygen. Okay, why we need this kind of the strenuous or the very unpleasant training? Because you are going to reduce the oxygen level. Usually, we require normally to perform any activities, we require oxygen. But here we are going to reduce the oxygen. So that we are going to call it as a hypoxic training. And especially for the rehabilitation, which is the new frontier in the physical therapy management. Okay. So though you are going to join for any program for the medical practice or non-medical practice, or if you are going to train yourself in such area which we call it as without oxygen or less oxygen, so we call it as a hypoxic training. Okay, I'm just going to give you some of the important benefits of this training, how it is going to help for the athletes to improve their performance in a different altitude adaptation. Because here in normal plane surface, when we do the exercises, so that will not give you much tougher, okay, in performance. When you go into the high altitude, if you go to the mountain, if you go to the high altitude level, okay, so then your oxygen level is reduced. You just imagine that oxygen level, if you're not able to cope up in training, so automatically your endurance is improved by the double. So it is not everyone to go to the high altitude. So that's why we give the same simulation, same kind of the sensation of the high altitude in the gym itself or in the ground itself. Okay, so for that we are going to use a technology which is called a hypoxic training method. So which will be enhances the performance, aerobic performance, sports performance of an athlete. Okay, so without much delay, I just want to give you some kind of the questions to be remembered. So why we are going to use the hypoxic training? So what is the primary purpose of the hypoxic training? Okay, I have given some points from the last 5 minutes of the narration. So what is the hypoxic training? Why it is mainly used for? Yeah, if you know the answer, please give the answer in this comment box. Yes, good. Yeah. So improving the aerobic capacity and oxygen utilization. Yes, these are the correct answer. So when you want to improve the aerobic capacity, so automatically the oxygen exchange also improves and the tissue got oxygenation. Okay, and the tissue nourishment, which can causes there is no delay in the fatigability of the muscles which are involving in this physical activity. Okay, so that's the main reason. So why we are using the hypoxic training. Yeah. So my session, today's session, I'm going to divide into two important area. One is with the training benefits. Out of that one is the training benefits, how we are going to improve the performance, or we can call it as a performance enhancement. This is the two area which we are going to focus on this particular. Okay, so in this scenario, I just want to know about how many of you have the um, experience of physical exercises. When you perform exercises, so you feel that I'm feeling good, I'm feeling improved my muscle power, I want him, I just gained my muscle growth. Okay, how many of you had this kind of the experience? Say yes or no. Yeah, very good. Okay, so why it happens, why it is developing? When you do the exercises, what happens inside the physiological changes in our body? Okay, so when you are going to, whenever you are going to use this, any kind of exercise, so we should know the changes, what happen inside the body. Okay, that we can call it as a physiological adaptations. Of course, I'm not going to use some much difficult terminology. So physiology is basically the function of the body, what you have studied in your lower classes. Okay, the function of the body. So here, the many adaptations, especially our tissue, which is gaining the every part of the cell and tissue will gaining the power in some area, that is we call it as mitochondria, the energy towers of the body or the cells. Okay, that we call it as a mitochondrial activity. So this mitochondrial activity has been enhanced by the enormous production of the RBC followed by this hypoxic training. That is the first important reason why this training is most important for every athletes. So the oxygen transport, enhanced oxygen transport, and as well as the mitochondrial efficiency, these two are the major physiological adaptations what we are expecting from this hypoxic training. Okay, sometimes the better oxygen utilization, so especially happens with the two activities. One is heavy weight lifting, that is anaerobic activities. When you are doing a jogging, running, normal walking, cycling, swimming, these are all kind of the aerobic activities. So both are together in every part of the athletic training. So our main is overall athletic performance, how we are going to improve by changing or by adapting these physiological changes. Okay, that we are going to say that strongly. This is nothing but it's a hypoxic training. Hypoxic training, which is helping us to improve the in fact performance of an individual or athletes. Okay, so the main thing is there are many reasons, many factors are important. So here there is a low oxygen availability which is causing the hypoxic environment. We are reducing the oxygen level and we are causing this hypoxic environment. That is a major part in this focus of this topic. Okay, now coming to the point, how it is going to directly connect with the performance of an individual athlete, how they are performing well in this particular training. Okay, so after the person who are you going to use that, there are some of the mask which is going to be given to the athlete. I think, I hope you are able to see this. This is a mask, it looks like a normal mask. Okay, it is just like, it looks like a normal mask, but what we are going to do this, here we have a adjustable, we have adjustable the window that will close the entry of the oxygen or atmospheric oxygen, so which enters into the lungs. Okay, that will be controlled by this. There is a option which is called a knob which alters the amount of the air entry. Okay, so there are minimal entry you can able to find from this mask, so that will be help us to change the same simulation of the high altitude. Okay, when you reach to the 1000 meters, 1500 meters and 2000 meters, so like this we have adjustable alternatives, knobs are there, so that will stops the entry of the oxygen and creates the environment where there is less oxygen. Okay, it's low oxygen only, not completely without oxygen. So we are just altering the levels of oxygen. Then we are going to use this mask as a hypoxic trainer mask. Okay, so this will be helping to perform any activities with this mask. Then the person's ability of the aerobic capacity and endurance, that can be improves gradually from this particular part. Okay, it will not only improve the endurance and aerobic capacity and the enhanced oxygen efficiency and support for metabolic processes, especially during exercises, and that will comes into the help of the performance outcome as well. Okay, so with this major point, is a key point for this particular type of the hypoxic training. Okay, so now one more important, yeah, simple question to all of you. Okay, so which method, yeah, which type of the method simulates hypoxic training without going to altitude? You don't need to climb to the Himalayas. You don't need to go to the Mount Everest. You don't need to go to any of the country Alps in Europe. So no need to go anywhere for training. So you can do training within your place itself. Okay. Do you think which one is that one? Yeah. Please mention in the comment box. Yes, very good. It is nothing but using the high altitude mask which I have shown, or sometimes hypoxic chambers also used in some particular training centers. So, which is a cost-effective method is about nearly about using the mask and do the training under the simulated environment. Okay, that is what we are going to do it with this hypoxic training. Okay, so what will happen when we do this one? What will happen? So do you think will it be causing any issues or any injury level or any kind of the uneasiness? Okay, so will it helps in improving the recovery? Yes. So hypox training is very important for the improving or enhancing the recovery process after any physical activity or exercises, especially when you are giving the training for the athletes for giving a low level of the oxygen. So the body adapts to the function very efficiently, and they will be pushing quickly to recover back to the for the any strenuous activities. Okay, it will help us to regain also, and this particularly helps to not to delay the fatigability, or instead of that it improves the muscle repair, and also it helps to reduce the any inflammation, and also it will helps to faster return to peak performance level. Suppose if you are going to give a cycling for a person, so if he reaches to the peak level within a 1 minute or 30 seconds, so then the same kind of performance can be encouraged, or will be after 3 to 5 minutes of the training, then the same performance can be improved in a consequent level. So the recovery is not a danger. Many times the person who got a hypoxic situation, the recovery is a challenge one. But here we are going to use a gradual high altitude training. Okay, from different levels. Thousand first initially 1,000 meters of the high altitude, and 1,500 high altitude, and 2,000 meters. Because we are going to give a gradual increasing of the altitude training. Okay, so that is the reason why the recovery improvement is also, it's a one of the possibility. Okay, now the second stage, and also this is one of the important final stage. Coming to the point, what are the strategies I'm going to use? How we are going to use this hypoxic training? So when we are going to start this training, so how do we check this person's ability to breathe normally or not? So we have to check the person's normal level. For example, if you are going to choose the player, how do you choose the player? How do you choose the player? The person is going to participate into the uh, kind of the cardio activities, for example, long distance running, okay, where there will be aerobic metabolism, so which is taking part in this training, or as well as with the contest. Okay, so if the person is performing into the quick runner, just 100 meters dash sprinters, so what kind of the training they are using? So we are going to analyze first what are the training methods they are going to use it for this particular one. So that particular point of the methods which we are going to focus on this way. Okay, so when we are going to use the altitude training, so we are following some protocols with the methods of training, and as well as the starting with the warm up, and as well as with the training method and the cool down method. So all these methods which we are going to follow in this high altitude training protocols. So it is not only for the performance, also the person should not get any kind of the harmful incidents. Okay, that is the main important part of the rehabilitation. Yeah. So after this, how we are going to monitor the patient, the person. So how we are going to analyze the importance of the training. So that we are going to use it with the various tools to measure. So we are going to use with the mask as well as along with the mask. We are going to check for the heartbeat. So cardiovascular system analysis using with the use ECG. Okay, we are going to monitor the treadmill ECG or stress ECG methods for identifying the abnormal variation of the heart. So basically, when we are going to look for the changes, nowadays you know very well about the importance of safe training in the gym. Many people suddenly collapse in the gym. So in that scenario, so how do you want to prevent the chance of the sudden collapse? So these things need to be addressed very carefully. Okay, that's why we always in our training setup we use the portable ECGs. In last webinar also I have mentioned the same thing for the heart rate reserve and target heart rate. So like this we are having a different protocols we are going to follow for the safety precautions. And the people, yes, of course. Now I just want to. How many of you uh, going for a training or any other sporting event in your schools and college? Anybody practiced before? Yes. Anyone practiced before? Yes. I don't know how many of you know about the maximum heart rate. Maximum heart rate. Anyone know what is mean by maximum heart rate? Yeah. Just put a message in the chat box. Yes, good. It's nothing but your age. Your age is the key factor to measure this maximum heart rate. Very simple. If your age is 20, okay, simply you can use this formula 220 minus your age. So, what will be your maximum heart rate? Of course, it is 220 minus 20. Very simple calculation. Yes, 200. 200 is the your maximum heart rate. Okay. So similarly, we have the different formulas to identify so whether the person is able to recover back after the training. Okay, normal one is by doing the ECG, we can check the ECG variations. Okay, in advanced exercise ECG, we can check it for the abnormality and very simple way your heart rate, just measuring the pulse. Okay, you have to go to the academy if you are going to train some of the players. You have to check the pulse rate. Usually we check for the pulse rate from the your the wrist area. We can check the pulse. Okay, but basically when you are going for the athletic population, it is always important to check from the jaw. Near the jaw you can just feel that, that is we can call it as a carotid pulse. Okay, this is the area where we can check the ideal heart rate of the individual. So like this we can check this one for counting for the 10 seconds. Okay, we have to check accounting for 10 seconds only. 1001, 1002, 1003, 1004, like this we have to count for 10 seconds, and then you can find out how much for the 6 multiplied by 6 we can get for the 1 minute of the normal heart rate. So you know very well about this. Normal heart rate is okay 72 beats per minute from the books what you studied. Of course it is a range between 60 to 100, 80, 90, 100. So also we can have this normal heart rate only. So in that case the person who are having with the doing exercises, the heart rate should be recovered to normal. Suppose your starting heart rate is 70, when you do the exercises, it reaches to 100, 110. Okay, then it has to come back. If you stop the exercises, it has to come back to here, baseline 70, and it goes to 100. And again, if it come back to the same level, or you can call it as a baseline. So if it comes back, that person is normal. Okay, but how long it takes time to come back? That is very important. We have to check first. After 1 minute it comes down, after second minute it comes down, and after 3 minutes it has to come and match the baseline. Okay, if it is there we can able to identify the person fitness level is good. Okay, it's simple thing then. Okay, many times people are having a different idea or methodology. um, they have to follow the some guidelines for this is the one way to simple identification of the maximum heart rate. Okay, without you don't require the ECG, you don't require any medical devices to check that your player. or you are anyone who is doing a gymming activity. Okay, so in this regarding, I just want to specify the importance of this training. Coming back to the hypoxic training, so which is helping to improve the person. So that is not improve the endurance of the individual, also the sports performance, but it should not affect the individual performance of an individual, and you should not go far into some struggle. Okay, that's why the monitoring the athlete's response by checking the heart rate. Okay. Nowadays, after COVID, we know another one important device. I don't think so. Everyone know about this device, which we are going to use it by checking the oxygen level of the individual by just keeping checking on the saturation level in the uh, especially for the fingertips, we can check the saturation level of the oxygen saturation level. Okay, how much oxygen saturation? These two are the important points. One is heart rate, another one is oxygen saturation. So these 2 points need to be checked and monitored immediately after the training. So the last but not the least one. So the point which we are going to integrate these hypoxic training techniques, and especially for the any rehabilitation programs. So for the person who are having a major threat in the injury after recovering from the injury. So this particular point which we are going to focus for the improving the recovery rate, the higher recovery rate is being evident on this particular hypoxic training, and as well as the patient, the outcome of the individual athletes, they achieve the very quick outcomes followed by this training. So, and specifically when we are going to use the some strategies to improve the lung capacity and and aerobic endurance. So, by the various repetitive activities and different without having any struggle, the person reaches to the higher altitude trainings with the similar and simple environment, and advanced devices also available over there. This is actually a very basic device and support. Anyone can use it with the medical practitioner's advice. Okay, if you don't have any previous lung problems and heart problems, anyone can go for this training. Okay, without any problem. Okay, so this is one of the foremost latest technology which is used in most of the training centers. Okay, of course, you might seen this in many of your favorite players. When nowadays IPL is going on, your favorite players are undergo for this high altitude training also to improve the endurance. Okay, so yeah, without much delay, I just want to conclude this session. So, I just give a recap of all these one. So, why we go for the special training other than hypoxic training. So, this is the only reason we need to go for it. The last but not the least, the lung capacity plays a major role among the different populations. Just imagine you are from any part of the country, maybe in the Asia or any other part of the world. Okay, but the lung capacity is not same for all the continent, but we are going to fight, I mean fight for the sports, especially I'm not mean of some other way. Fighting for the sports is the Olympic event. We play for the global contestants. Okay, so so it's the right time to focus more on the this endurance and lung capacity in any of the sports. Okay, again I'm thankful to the provide this opportunity, share this take home messages. So know your lung, okay, and improve your lung. That's it.
Thank you so much, Dr. Thai Garajan Subramaniam. Can we take the questions, Dr. Thai Garajan?
Yes, yes, sure, sure.
Thanks for
Yes.
giving me chance to address your questions. Kalki Avatar is with us. Kalki, you can ask questions to Dr. Thai Garajan if you want to ask any questions.
Uh, Hello, sir. I actually wanted to ask because you're talking about hypoxic training. So, at the higher altitudes, like we do mimic the conditions down at the lower altitudes, but the condition at the mountains also change per second per minute because the wind speed, the amount of sunlight, what's the moisture over there, everything changes. So, how do we mimic the same thing up there down here at the ground level?
Yeah,
Because
of course.
whereas I
Yeah, of
know,
course.
because whereas I know even the research papers they do evident about this factor that the hypoxic mask is not that much useful for the same.
Yes, of course. I agree with your point. Your question is over. Shall I go?
Sure, sir. Please go ahead.
Yeah, yeah. Actually, no. So actually, there are many research evidences are supporting. Okay, some of the criticizing the evidences are there. Of course, they have some positive results in their particular environment. What you have mentioned about is controlled environment. We call it as a controlled environment. Okay, I have. We are planning for some workshops for complete detailed program for this, but it's a kind of just I am giving for information, just like a superficial information. So we are going to monitor the atmospheric level. What we are going to use it outside the ground, we are going to simulate the same similar part. Okay, and of course there are some
Because
flaws when you are doing some training with the different populations. Okay, and some
because
studies have
we
been
did the
shown
same
that with the effect the effects
because
of
we did the
the
same.
mask which are used
Okay,
without the mask.
because we did the same thing. I am a researcher here in the United States, and we did the same research.
Sure.
We have a state of an art environmental stimulation for the athletes, and we work for the football players, like the rugby players, more specifically speaking for the Indian population. So yeah, we were not. We, it's not the same, even with the hypoxic mask. Hence, I thought I'll ask you.
Yeah, actually, we try for the actually prerequisite conditions of the players and the person who requires the demand. Okay, then only we are going to choose that one. So we are going to include some criterias are there. We are going to include those population and we'll test them. Then only we are going to do that. We check the
Okay,
pulmonary
could
function
you
testing before. Yeah,
okay? Could
pulmonary
you
function testing
tell
before, and we check
which were
for the
the
FE1 FEC ratio and
okay?
those
Could you
things
tell
only.
which
Then
were
only we
the
are planning for it.
criterias? Could you tell which were the criterias like for according to your experimentations, etc.?
Yes, yes, that's why I'm telling. I was telling that only using with the pulmonary function testing. So we try to check that patients who are having a good FEV1 above 70, 80 percentage of FEV1, and the person having a FE1 FEC ratio also should be above 80 percentage. Like this, we are going to using with the. You can please refer American College of Sports Medicine guidelines for the hypoxic training and other endurance aerobic training methods. Okay, so there is a exercise prescription for ACSM guidelines. Okay, you follow this
Yeah,
one, you'll get a lot of
we
information.
definitely follow that over there. But like another question which I have
Yeah.
is like EFT is not that evident. Like it's just a rough indication or markers of what exactly how the lung capacity of an individual is.
Yes,
Isn't
we can
VO2
go.
max a better machine, a better
Yes, yes,
parameter
that's why
to
I'm telling next. Yeah, that's why I'm telling this is actually basic parameter we are going to. We are going to also view to max, but it's a cost of nearly around 40 to 50 lakhs above for every academy cannot afford this. That's why I'm giving that some basic requirement to go for the training with the very minimal requirement. Okay, only the research institutions like funding agencies only can afford of the VO2 max device. Right now, the cost of the device is huge large. So that's quite large about that. That's why I'm just mentioned this. The first preliminary part of the preventing the any abnormal or uneven and unpleasantful sensations during the exercises. Okay,
okay.
VO2 max is the high next level cardiac exercise testing. Yeah,
Okay, thank you.
very good,
Thank you
very
so
good.
much.
Thank you.
Thank you so much, Dr. Thai Garajan. I hope Kalki Avatar you got your answer from our expert, Dr. Thai Garajan. So can we take the next question, Dr. Thai Garajan?
Sure,
Yeah, someone is
sure, sure.
asking here. I mean, the Gurpreet is asking here, what psychological adaptations occur during hypoxic training that make it beneficial for rehabilitation purposes?
Yes, mainly the psychological aspects of the injury. That's the first important thing is the injury. Especially, just imagine if any one of us we get an injury or some kind of the disablement. When we are struggling with starting this session, we struggle with some technical glitches. So we faces that some kind of the problems in our every activity. So the psychological impact on every injury which is first thing is about their career loss, the loss of the career, or nowadays the competitiveness in the field. So it may causes there will be agitated mode when they are performing. So the performance level, that also if they are when a person who is not having any injury and directly going to the contest, that's a quite different scenario. Their psychological strength is a little bit higher than the person who got already injury. So what happened? We stop the injury by giving some rehabilitation. We give some, for example, muscle injury. We apply the tape and we try to make the player to perform again. But the problem is that there is a fear of the pain, fear of the again re-injury. So this is the one which we are facing the struggle. So we are working on cognitive impairment in sports athletes also. So that also a clear picture of the how we are going to train the people in a very short interval. Okay. So psychological adaptations, of course, this answer I am trying to give this answer, but it's not in my domain. It's exactly how we are going to use the sports psychologist can give you a better answer than this. Of course, my answer can uh, fulfill the doubt of the uh, Ms. Gurvinder Kaur, I guess so.
Thank you so much, Dr. Subramaniam. I hope, Gurpreet, you got your answer from our expert. Megha is asking here, what specific patient populations could benefit the most from hypoxic training in physical therapy?
Yeah, shall I?
Yes, you can answer this now.
Okay, okay. Yeah. So the major important thing is injury. If suppose if the person is having the two types of injury, one is with the major injury in the sense to broad spectrum of the training. When you are doing with your upper body, for example, upper limb injuries. Okay, then there will be a no much limitations for the performance of the lower limb activities. They can able to walk, they can able to run, they can able to do other activities for the lower limb. Suppose if it is a lower limb injuries, the lower limb injury, some of the physical activity is been reduced, then we go for the some of the low impact exercise. So the main thing is the impact of injuries. The impact of injuries only it warrants which type of the training to be used. Okay, suppose if I'm using the hypoxic training, using with the hypoxic mask which I have shown you already. So with the cycling, so in cycling we can just provide with the if the person is not having any knee injuries, then only cycling is possible. Okay, so the particular type of the injury and the impact only decides when we are going to start or when we are going to stop the particular training. Okay, so it does not mean that the most of the injuries we are going to, it's actually the injury which is impacting the aerobic endurance, then we are going to use this. So this is actually I'm giving a broad spectrum of the injury. If you tell some injury name, I can suggest which type of training should be useful to that. Okay, but broad spectrum, when you are going to stop your exercises to improve aerobic endurance, then this is the one which can be a best option.
Thank you so much, Dr. Subramaniam. I hope all the participants got their answers from our today's expert. If you have any questions regarding admissions, you just write on our set admissions@lpu.co.in. You can do for WhatsApp chat with us. Our WhatsApp number is 985256900. I'm repeating the number. It's 985256900. Once again, thanks to our expert, Dr. Thaigarjan Subramaniam. As we
Thank
come to the end of this webinar, I want to express my deepest gratitude for experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding admissions. If anyone wants to access this webinar again, they can visit our website, that is lpu.in, or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.